Hey, what's going on, guys, and welcome back to another video of Keep It Simple Stupid. And today we'll be discussing the types of miscarriages, and of course I'm going to try to make it as simple as possible. I think these were always very confusing to me as a medical student, and even into training. I would get it mixed up all the time. So again, like everything else on this channel, what better way for me to understand it than to teach it to all of you? All right, so let's go ahead and get started. But first things first, let's keep it basic. So what is a miscarriage? So a miscarriage is the loss of an intrauterine pregnancy less than 20 weeks gestation. And the next question might be, well, what would you call it if it's at 20 weeks or it's greater than 20 weeks? And that will be called a stillbirth. So here we go. I have drawn out very basic in a cartoon fashion, kind of the basic anatomic structures that I think you're going to need to know to basically understand the different types of miscarriages. So let's go ahead and we will start here on the left with threatened. So in the center here, this is going to be the uterus. On both sides is your fallopian tubes. In the center here, that little gray dot, that's going to be your products of conception. Down here is going to represent the cervical os. All right, so now that we've covered some of the basic anatomical structures, I'm going to give you kind of the basic, I would say, breakdown for how to kind of remember these two different classifications of stages of a miscarriage. And I didn't come up with this. I've heard it through medical school and then on other online videos. There's going to be threatened, complete, missed, inevitable, or incomplete. And the reason I have a little divider here in the center is that for the stages of a miscarriage that start with a vowel, the cervical os is open. All right, so that's going to be everything on this side. Whereas the three on the left side of the image, these involve the cervical os being closed. Now I'll go ahead and we'll walk through each one and I'll kind of explain it and then do a comparison between all five. Coming back to threatened. So generally this presents as painful or painless vaginal bleeding, again, less than 20 weeks gestation. And here are kind of the defining factors of a threatened miscarriage. Step one is that the products of conception are still intrauterine, and I've drawn that up here. The fetus is still viable, which basically means that if you performed a pelvic ultrasound, you would see a fetal heartbeat. And then important here, the cervical os remains closed. In a threatened miscarriage, that does not necessarily mean the pregnancy will not be successful. It just means, again, like the name points out, that a miscarriage is threatened. Moving over to complete. And again, this being on the left side of the image, this represents our stages of a miscarriage where the os is closed. So in a complete miscarriage, well, if you kind of think about, what a miscarriage is, and it's complete, then it kind of makes sense what steps you may see under this stage of a miscarriage. Step one, if it's complete, right, it's finished, all the products of conception are extrauterine, right? So they've all been passed. I've demonstrated that here with that little gray circle. And again, if all the products of conception have passed, well, it's non-viable and there is no heartbeat. And then finally, your cervical os will be closed. And that makes sense because it's gone to completion. The cervical os opened, the products of conception were passed, and now the os has closed. So that is a complete miscarriage. We're going to move on to missed. Okay, a missed miscarriage. The way I like to think about a missed miscarriage is that the miscarriage, it has completed, but what we're missing is passage of the products of conception. So what do I mean by that? So as you can see, the products of conception are still retained intrauterine. Since it's missed, the fetus is non-viable, so there is no heartbeat that would be detectable on ultrasound. And again, I've kind of drawn like the little red X there through it just to remind you that it's non-viable and there's no heartbeat. And then finally, another important distinguishing factor about this stage is that the os is closed. So now we're moving on to inevitable and incomplete. So again, these are the stages where the os remains open. And then you can kind of see I've tried to illustrate this here with my cartoon drawings. So we're going to start with inevitable. So with an inevitable miscarriage, step one, your os is going to be open. And then if you kind of notice what I've drawn here is I've drawn the products of conception kind of closer to the cervical os. And what that means is that on a speculum exam, obviously when you're going to see that the cervical os is open too, you may see products of conception through the cervical opening. And again, what this means is that from a viability perspective, there may or may not be a heartbeat. However, This stage of a miscarriage is described as inevitable because even if there is potentially a heartbeat, it is inevitable that this stage will advance to a complete miscarriage. The last stage we'll discuss here is incomplete. I like to think about incomplete. It's a little more advanced beyond the inevitable miscarriage stage. So step one, and I've kind of illustrated this again, is that the products of conception, they can be a mix of intrauterine and extrauterine, right? And I've kind of drawn it here to try to illustrate that there may be some products of conception retained in the uterus and then some that are now outside of the uterus. It is non-viable, there is no heartbeat. And then finally, like I've illustrated here, the os will be open. You may kind of ask yourself, so how do I distinguish between inevitable and incomplete? Well, again, the way I like to think about it is that, one, if the products of conception have now passed through the cervical os and some of it is intra and some is extra, then you have incomplete. Whereas if it still remains retained within the uterus, even if it is visible, that is inevitable. If it's still confusing to you, maybe one more way I can explain it that might make a little bit more sense is I could kind of walk through the stages here in almost a chronologic fashion. Say that step one, a patient's presenting because they're having vaginal bleeding, less than 20 weeks gestation, so we'll say threatened is stage one. But say for our example, we will say that a miscarriage will go to completion, as in the fetus will be non-viable and then the products will pass. So again, step one would be threatened. Step two, be inevitable, right? Because now your os is opened. The products of conception have started to migrate towards the cervical os. Once they start passing, 3 would be incomplete. And finally, the last stage would be 4, which would be complete. Now, if you've probably noticed, I didn't discuss the missed miscarriage. Well, it's almost kind of a different pathway here. So say we can call inevitable 2A, but what missed would be is you go from that threatened stage to the end of the pregnancy. So we'll call this 2B. And again, that makes sense because, again, the fetus became non-viable, so it no longer had a heartbeat. However, the miscarriage didn't advance through the stages of inevitable, incomplete, and complete. All right, guys, well, that's all I have for you today. I hope this was helpful. It can be a confusing topic. It's been confusing for me. I hope I didn't make it more confusing for you, if anything else. But as always, like, comment, subscribe. If there's anything you'd like me to discuss, please leave a comment, and I'll see you guys next time.